Hey, it's Dr. Trish Leigh. Today I want to talk about spinal decompression for bulging or herniated discs. So if you have chronic or extreme or both pain in your neck or any place in your back, your lower back, then you may be a candidate for spinal decompression, and it may be due to a bulging or herniated disc. So many people have gone to their doctor and have had an MRI and know that they have a bulging or herniated disc, but do not know what to do about it beyond medications, pain management, just managing the pain, or surgery. Well, I would like to tell you that spinal decompression using the DRX 9000C is very effective for alleviating pain and actually reversing the herniation or the bulging of the disc that is creating the problems. And it's all proven by science. So the way that spinal decompression works is it basically gently separates the spinal column so that the discs can go back into place where they belong, and then they actually rehydrate, fill with fluid again, and they regenerate. They become healthier because of having the room to be able to go back in. That's how spinal decompression works. And everything we do at Leigh Brain Spine helps the body to be able to heal naturally when pushed in the right direction. And spinal decompression counts in that way. So if you're suffering from a bulging or herniated disc, I would recommend that you check out spinal decompression because it can really help you feel better and perform better faster and get you back to the quality of life that you're looking for. Okay, thanks.